If you click this video away, then please tell me what the reason was so that I can improve. Otherwise, hi and welcome. I am trying to learn medicine today, asthma, and after we've done it, we're gonna do body-centered training. And if you participate in the body-centered training, then is that at your own risk. This is the second time that we are now reading this page about asthma here. And this is no medical advice, I'm just reading it and trying to understand it. Now we're going to go now over this text and we're trying to gather the informations together and memorize them and try to make them out of memory a presentation. Asthma. Asthma is, the book is from the 70s. Maybe some things have changed. Asthma is a word which often conjures up a frightening picture of patients fighting desperately to get their breath. So it is understandable that many parents may be apprehensive when they hear their child wheeze. But wheezy breathing is common in young children and usually does not indicate that true asthma is present or will develop later. We keep it back in mind, but our thing is not a medical advice, also a presentation, so maybe we're gonna not mention that at all. Asthma occurs when the small bronchial passages in the lungs become swollen with inflammation, partially obstructed by phlegm, or narrowed when the muscles surrounding the air tubes become tight, bronchospasm, and that causes a characteristic wheezing sound. So maybe we're going to say it. So what we have here is that we're having three things. The small bronchial passages in the lungs become swollen with inflammation. The bronchial airways become swollen, obstructed with phlegm, or narrowed because the muscles surrounding them are tightening, bronchospasm. And when we're going to say, and that causes now a wheezing sound, but just because a young child has a wheezing sound, it does not mean that they have asthma or that they're going to develop it later. It was now inflammation of the bronchial passages in the lungs, or obstruction through phlegm or bronchospasm. The muscles around them are tightening. Some babies go through their first year of life with noisy, sometimes wheezy, breathing which is normal for them. As they grow, the small air tubes enlarge and the wheezy breathing disappears. We're going to mention it. Now it can be that some information here are outdated or something, but we're going to say that some children or babies have it. It goes oftentimes away over the first year because these bronchial passages or the air tubes are enlarging. Asthma tends to run in families, and in one form it is associated with an inflammation of the skin, eczema. Maybe we can mention it. If I'm able to, I have to remember it also. We have a bit little informations. Asthma may appear for the first time in childhood or in adolescence, often as an extension of hay fever. It can also appear out of the blue later in life, the so-called late-onset asthma, which can be much more disabling than other forms and is often associated with recurring chest infections. So, it tends to run in families. It goes on the way. It was the inflammation and the obstruction for phlegm and also the muscle spasm, the bronchospasm, the muscle spasms. Now we're having, it oftentimes comes through during childhood or adolescence. There is also late onset asthma and later in life. It can come as an extension of hay fever. I don't really understand what that sentence means. True asthma is a respiratory problem, but the symptoms may be confused with cardiac asthma, which occurs at night in older patients with serious heart disease. Asthmatic bronchitis, sometimes called chronic obstructive airway disease, COAD, may develop after recurrent attacks of bronchitis. Okay, we're going to say that The recurrent attacks of bronchitis can cause chronic obstructive airway disease, chronic obstructive airways disease. And there can be cardiac asthma, oftentimes in people who have aged longer, but that is then because of heart problems. Symptoms of asthma: coughing, wheezing, and difficulty in breathing. The main difficulty and the wheeze is related to breathing out and not in. Okay, coughing, wheezing, and the wheezing and the difficulty to breathe are mostly with breathing out. In children, persistent coughing at night may be the only symptoms. Fast pulse and also drawing in of the lower ribs on breathing in. This is especially obvious in babies and young children. Okay. Having drawing in of the lower ribs when breathing in. The symptoms can be coughing. By young children, it can be the only symptoms of coughing in the night. And coughing and wheezing and difficulty to breathe are the things of symptoms. And difficult to breathe and the wheezing happens by breathing out the most. And fast pulse. Drawing is respiratory infections may cause inflammation of the tubes. Allergy to certain substances ranging from the house dust meat to animal fur or feathers and pollens of foods. Nocturnal attacks in children are often associated with house dust meats, down pillows or pets sleeping in a child's bedroom. Anxiety or excitement seems to precipitate attacks in some people. Now I don't understand, is it causing it? Or is asthma the symptom of these things? Or are these symptoms starting the asthma to become present? It is all the time asthma, but when they're happening, if these other things coming additionally to it. I think it's the latter one, what I said. Treatment in the home. Both a child with asthma and the family must learn to adjust to the long-term problems of recurrent asthma. The child must be encouraged to lead as full and normal a life as possible, yet at the same time be helped and supported to do this by parents and doctors who understand how modern drugs can be used to prevent and control attacks. Mild and transient wheezy breathing occurring for the first time in a child should be reported to a doctor. Also consult a doctor if the wheezing causes distress, if there is cyanosis, if there is indrawing of the chest on breathing in, if the pulse rate is fast, if the wheezing continues for several days. In adults, the doctor should be consulted if any of the above symptoms cause distress or anxiety, or in the event of a sudden severe attack. What the doctor might do: prescribe medicines that can cut short, prevent, or modify sudden attacks and control more prolonged bouts. Okay, there's medicamentation. Control any respiratory infection by the use of antibiotics if the cause is bacterial. So if there is a bacterial cause, but also treating of the respiratory infection. If the doctor suspects that an allergy is responsible, he or she may attempt to identify the substances causing the reaction. It is sometimes possible in adults to reduce the patient's sensitivity to the substance by a course of injections. If it is allergic to the region, the cause of it happening, okay, we're not going to mention it. That sounds like a medical advice. Children may develop more than one allergy at a time, and it may be necessary to reduce contact with more than one potential cause. It can be that someone has... Okay, we're going to mention these 4 things. A respiratory infection can cause it, allergies against substances. It can be dust, animal fur, feathers, dust meat, animal fur, feathers, pollen, foods. Or also for anxiety. Anxiety seems to aggravate it. Now, and the cause can be more than one. If it is allergic, it can be more than one thing. So just taking away just one thing is maybe not enough, because the second one can still be the cause of the symptoms. And now the person never finds out if the thing removed was it or was it not. Asthma cannot be prevented, but the likelihood of an attack can be reduced by taking certain precautions. Not to smoke, to keep out of dusty, smoky surroundings, and seek prompt attention for coughs and colds. To keep attention on coughs and colds, away from dusty and smoky areas, and not to smoke. Now, we don't have time left for the presentation right now. That means we're going to do a third part to asthma, and where we're going to go fast as possible over these informations again when we try to make the presentation. That means if you were here for medicine, you can go directly to the next part of the medicine. If you stay here and participate in the body center training, then it's at your own risk. The legs are standing hip width apart. We're going a bit down into the knees, flex the legs and press them together. And now straighten one leg. And bend it. Other leg straighten it. Bend it again. Wider apart and press together. A bit down into the knees and press together and flex. And straighten one leg. And everyone, straighten it. And bend. A bit higher up. And press to the outside. Next exercise. One leg up. Right angle with the leg, flexed foot, even aligned hips, taller with the back, little bend in the elbow, and press on the top against the knee. And press on the side. Press up and to the side. And press on the outside. The heavy swing door exercise. To the outside. And again in. Other side, press on the top. And from the side. Now up and to the side interchanged. And the heavy swing door again. Press on the outside, stand stable and open. And close again. Now 3 exercises on the ground. First is side plank on one elbow. With one leg up if you can and like. And now on the long arm. One arm out, one leg up and put the knee to the elbow. And over to the other side. First on the elbow. With one leg up. And on the long arm out, leg up and put knee to elbow. And up again. One heel up to the ground, the garden gnome exercise. Pull the toes in and move the leg from left to right. Other heel up to the ground, pull the toes in, move the leg from left to right. And pull one leg up. The mushroom. And the other leg. Pull the leg up, point with the toes down, and relax the leg. Take the leg at the ankle, make a straight back, and point with the knee down to the ground. And the other leg. Straight back, knee down to the ground. The crane. And legs wide apart, breathe in and go down. And breathe again out. Again in. And out. Breathe in and close the legs. And breathe again out. That was body center training. I thank you very much and until next time.